Hi there, I am Dr. Zakir, Senior ENT Consultant. We shall discuss about structure of a normal eardrum. So, the ear can be divided into three parts: outer part, middle part and inner part. The eardrum, it forms the innermost part of the outer ear canal. The middle ear, for the normal function of the middle ear, it needs the presence of air. That air comes from behind the nose, here, from the nose. See, you have a small opening behind the nose, and from here, through the small tube called the eustachian tube, air reaches the middle ear. So, when you have air in the middle ear, it functions normally, and the eardrum also functions normally. Now, coming to the appearance of the eardrum. This is a real photograph and this is a diagram. So, if you look at this photograph, you can see that the eardrum as such, it is glistening, grey in color or silvery in color, and when you see with the camera or the light, you can see a light reflection only one particular part, which is mostly anterior. This is a normal appearance of the eardrum. Now, the eardrum as such can be divided into two parts. Before that, let me tell you about the dimensions. The dimensions of the eardrum, it is approximately 1 centimeter only. To be specific, the height is 10 millimeter and the diameter is 8 millimeter. It is not exactly round. And the angulation, it is not 90 degrees, it is oblique, like how I have depicted in this diagram. It is approximately 55 degrees angled. Now, coming to the parts of the eardrum. The lower part, the pink drawn part, it has got one name, which is the pars tensa, and the upper one is pars flaccida. I have shown in two different colors just for you to understand. Why it's called tensa? Because it has got three layers, both the parts it has got three layers, but the pars tensa part, all the three layers are well formed and it is tensed also. That's why it has been named so. Likewise, the flaccida is flaccid because the middle layer in this part is weak. So, these are the two parts of eardrum, and you have all the important structure in the upper part, not in the lower part. Now, mainly the pars tensa part, as I have mentioned, it has got three parts or three layers, like how you see in this diagram. The outermost layer, like our skin, it has got 4 layers, and the middle layer, you have 2 layers which is in two different orientation. Outer layer is radial and the lower layer is circular, and in between you have parabolic. That's how it is arranged in the middle ear. And this is a layer which is weak in the upper part of the ear, which is the pars flaccida part. And the innermost layer, which corresponds to the inner ear, it contains glands and few hairs and hair cells too. Eardrum has got good blood supply, likewise it has got good nerve supply too. Now, to have a look of the eardrum, nowadays we use endoscopy, so that we also can have a better look and we will be able to show the patients also with the help of a TV monitor. Before winding up, I want to tell you one important point, that the outermost layer of the eardrum, which needs to be replaced, it is not replaced like how it is done in the skin. Normally, what happens in the skin is, you have old layer below and new layer, the skin replacement layer is from below upwards. So, when we take a bath, because of friction, the outer layer goes off, it is replaced by a new layer from below. As far as the ear is concerned, what happens is, all the outermost air cells, it migrate from inside to outside. It's a self-cleaning mechanism, naturally. So, what happens when you have debris or wax, anything you have in the ear canal, because of the migratory mechanism, all this dirt, everything will be pushed outwards. That's why we ENT doctors don't advise any patient to use any sort of cleaning material like earbuds or anything in the ear. You don't need to, because it has got a self-cleaning mechanism where all the dirt comes out by itself. You don't have to clean the ear with the earbuds. With this, let me wind up, and this is the structure of a normal eardrum. Thank you so much.